Good morning. Today is Saturday. It is our regular yoga therapy class, and let me do a little sound check. Check, check, check. Okay, I do hear. Okay, I do hear. Okay, so sound is good, and Linda has also checked the sound. Thank you, Linda. So last few weeks we've been talking about chronic low back pain, and today we'll talk about yoga therapy for chronic upper back pain. I'm sorry I did the posting a little late last night. I was a little busy. I was doing a presentation for a program in Vietnam. We're doing a virtual presentation. So for chronic upper back pain, the first cause is muscle spasm. For the chronic low back pain, as you all know, whatever the underlying cause, whether it's herniated disc or a spinal stenosis, but it is still an irritation of a nerve and a contraction of the muscle, and basically it's tightness, spasm of the muscle which causes the pain. On the upper hand, the chronic upper back pain is primarily to the back, which is the tightness of the two muscles. The two muscles name, one is called trapezius, another is called a levator scapulae. And the underlying cause is the posture. In the thoracic area, in the upper chest part, the intervertebral disc, like called the disc in between the vertebra, does not herniate. Herniated disc is very rare. They do not have a rupture of the annulus around it, and do have an irritation of the thoracic nerves. In the thoracic area, chest and lumbar area, the spinal cord outflow, that means the nerves going out of the spinal cord, also has primarily sympathetic nerve fibers. We call it a thoracolumbar outflow for sympathetic, and we call it craniosacral. Cranio means head, and sacral means lower part, called the sacrum, lower part of the spine. Craniosacral is your parasympathetic output. Chronic low back pain is very severe. Chronic low upper back pain is also very severe, and also originates from shoulder, dysfunctional shoulder, and all the shoulder pathology, which we will do another session, like a frozen shoulder, rotator cuff tear. But the shoulder pain also represents in your upper back pain. Same way as your neck. We will do another session on for chronic neck pain, what you do from the yoga therapy perspective. The chronic neck pain also shows up as a chronic upper back pain. On the other hand, this posture, we call it a malaligned posture. If the posture is not perfect, you will see there's a lot of symptoms even in your neck, in the chest, even in the shoulder, even in the arm. I actually had an orthopedic surgeon. He was diagnosed with a carpal tunnel syndrome. Carpal tunnel is there's a median nerve which goes through a tunnel in front of the wrist. It gets compressed and has a classic symptoms. The carpal tunnel syndrome is very classic for the hand. He did all the conservative therapy for the carpal tunnel without any help, benefit. Then when he talked with me, I looked at him. He had a serious posture issue on the upper part of the back, called the chest area, almost like a wing scapula. There are two bones here called a scapula, of which all the nerves are, all the muscles are attached. And when there is a spasm, the dysfunction, when there is a postural issue, one of the scapula even sort of lifts up and it looks like it's like a wing. The name called wing scapula comes. And also underlying condition, the muscles are weak and some muscles are not functioning properly, dysfunction. So coming back, the whole yoga therapy concept from the asana perspective, it is correcting your posture. We'll do those practices today, correcting those postures. And from the pranayama perspective, it is again the primary Bhastrika pranayama, bellows. As all of you know and told you all the time, Bhastrika pranayama is a pain relieving pranayama because it brings more oxygen, it causes aerobic glycolysis, and it removes the lactic acid, pyruvic acid, pain producing substances produced by the anaerobic glycolysis, low oxygen in the body for metabolism. A Bhramri pranayam, alternate nostril breathing, Anulom Vilom pranayam, Om pranayam, chanting, Murcha pranayam, bandhas, Jalandhar bandha, like your, we call it a lock, neck lock, root lock, abdominal lock, and your Jalandhar bandha, neck lock. So, to start with, whole yoga concept is a holistic approach. The difference between yoga and our modern medicine is a reductionist. Reductionist means if you go to see an orthopedic surgeon, or many people go to see a chiropractor for a pain sitting here. I'm incredible, excruciating pain, looks like almost like a knife stabbed into the back. Their focus will be primarily on this spot and trying to work the muscles on this spot. On the other hand, the yoga practice, which is a relaxation response, which is the activation of parasympathetic tone, will start with relaxation of your hands, your wrist, your elbows, your shoulder, your neck, then your upper back. And when all this relaxation takes place, the relaxation of the upper part of the body will also relax the rest of your body. So all the therapies you are going to do for the chronic upper back pain, it will also help you getting relief of your chronic low back pain, because that is due to tightness of the muscle. Will be pain in your hips, pain in your knees, pain in your ankles, and you can name it. The word holistic, I always say, it means hold. Somebody forgot to put the W in front. So it's a total body practice. So the practice will be a relaxation of the muscles of the back. In some of the chiropractor practice, and you'll be surprised today, the chiropractors, physical therapists, they have incorporated a tremendous amount of yoga asanas, not that much of pranayama or meditation, yoga asanas, to their practice. But they call them an exercise, which is completely opposite of yoga practices. Exercise is a sympathetic muscle contraction. Heart rate goes up, blood pressure goes up, respiratory rate goes up. So when you have a sympathetic, then body starts with your parasympathetic output. But on the other hand, yoga practice is primarily a parasympathetic output. So coming back to that person who is an orthopedic surgeon who had a carpal tunnel syndrome, after correcting his posture, wow, his carpal tunnel pain was gone. So again, you know, I'm sitting here on a stool called a kneeling stool, which most of you have seen by now. When you sit down on a kneeling stool, primarily you keep your body straight, spine straight. The moment you keep your spine straight, if you look at a person with a chronic upper back pain, you will see their back is hunchback. So you will never see a person with a straight spine having a chronic back pain with the upper or lower. This is the back. You will be seeing the hunchback that will start with the upper back pain. So when you start with the hand, as you see, when hand is relaxed, you look at your hand. All the fingers will be separated. It is a relaxed hand. Both the fingers will go easily in between. When it's not relaxed, it will be tight, you know. It is not going to go, it will go easily. Your wrist will be able to turn all around. It is a wonderful experience and relaxation. Guess what? Hand is relaxed, your upper back will be relaxed. Hand pain will go away. All the pain in the hand, all the small joint pain is due to your tightness, inflammation, arthritis, posture, you name it. It causes tightness of the ligaments in between the two bones, and also your muscles. In your hand, many a time you'll see you get a trigger finger. Like your finger will come and it suddenly go higher. You can use one of the tennis ball, because this is your normal hand functional posture. Hold into a tennis ball with your breathing. Breathe in, tennis will squeeze it. Breathe in. I had my tennis ball here somewhere. Okay, maybe next time I'll get it ready. It is breathe in, breathe out. Most relaxed person is our babies. So, baby fist, balo mushti mudra, how a baby closes the hand. Baby will put the thumb inside and close. This is your baby fist. We also call it a adhi mudra. Do with your breathing, breathe in, breathe out. Breathe in, breathe out. You also can do it putting your hands in front. Put your hands in the front, same way. Breathe in, breathe out. Breathe in, breathe out. Balo mushti mudra. Balo is the baby, mushti is the fist mudra. Wrist gets relaxed in extension. So you will do a wrist, breathe in, breathe out. Breathe in, breathe out. Wonderful gesture will be if you are able to, do, you can just sitting down. I'm sitting in this, my chair, to show it to you that if you can able to put your wrist here, another wrist here, and the relaxation of the wrist. The people say it's hurting me. If it's hurting you, remember the technique, back off. Stay here. Close your eyes. Breathing out longer than breathing in. Your neuroplasticity will set in. Same way, the wrist relaxation will be your, put your hand here and slowly see it will come down to the ground, all the way to the ground. So let's continue our practices. Since I'm sitting down, let's do all the sitting down practices. We come a little close to you, so. Adhi Mudra, wrist relaxation. Elbow. Elbow is relaxed with a called internal rotation. You rotate your hand like this. Elbow gets tightened up with the external rotation when you put the hand outside. Pain in the tennis elbow. When you put your hand high up, try to put the thing, you get tennis elbow. So internal rotation will relax your elbow. And the prayer pose to the back called Paschim Namaskar. You are doing the internal rotation of your elbows. Shoulder is a ball and socket joint, and many ailments of the shoulder, underlying pathology of shoulder, primarily shows up as an upper back pain. As I said, trapezius and inside a muscle called levator scapulae. They're the two primary muscles. You have big muscles on the side called latissimus dorsi, and in the front is your pectoral muscles, pectoralis major and minor. We know an patient who had this chest pain from the irritation of a nerve and a muscle spasm, almost like your coronary artery disease pain, the cardiac pain. The difference is, in a chronic upper back pain, either in the back or the front, pain will be on the muscle itself. So when you have a pectoralis major, even if on the left side over the heart, the pain will be on the muscle side. In the coronary artery disease, or I call it heart disease, the pain will be what is called a retrosternal. Behind the sternum, pain will be completely crushing, like some elephant is sitting on your chest, instead of this continuous, sharp, agonizing pain. For the shoulder, so since the ball and socket joint, you slowly rotate your shoulder. So you breathe in, breathe out. To the front, and generally you like to do between 5 to 10 times each motion. So you breathe in, then you breathe out. Go to the opposite. Remember, you always balance. Breathe in, breathe out. Generally, I also do with a little weight. I'll put a little weight, I'll stand up, and with the weight, I will do the shoulder rotation. Put your hand on the top. You can hold that on wrist. Breathe out first. Take a deep breath in. Slowly pull it down behind your shoulder, behind your neck. With your breathing. Breathe in, breathe out, and the same breathing cycle coming back in the middle. Breathe in, breathe out. Breathe in, breathe out. Continue a few times. People always comes and tells me, hey, I'm having pain here in my trapezius, in my upper back pain. And you are asking me to raise my hand, all this. Yes, because these muscles are all interconnected and all the pain is coming because of your posture. And one of the posture is also your shoulder. The hunchback comes from your lot of other factors. We also have an inherent tendency for the hunchback when we are getting mature, when we become a senior. This is also due to imbalance of the muscles. That's what we said, we always practice a balancing. A lot of people ask me, what is your question about I'm losing my balance? Because you're losing your functional coordination. Like one muscle is getting weaker, another is overtaking it. So you have to do a balancing practice. You put your hand on the shoulder, elbows together, breathe out first, take a deep breath in, and slowly rotate your shoulder with the breathing out. Breathe in, in, breathe out. Do the opposite way, breathe in, opposite side. Tightness of the neck, because this is occipital tubercle. The two muscles are there, sternomastoid muscle, trapezius muscle, both are supplied by cranial nerve, and you get a tremendous amount of upper back pain. We will show you a asana pranayama combination practice of how to relax the neck muscles and the neck area. But one nice way of doing it is that doing it, pushing it against resistance. Like, what does it mean? The one hand you do your Dhanu Mudra or Gyanu Mudra, it's very relaxing, put it there. Then you try to put your head on the right side, and on the right hand you are pushing it back towards your left. So action and counter action. I'm trying to put my head on the right side and my right hand is pushing it back towards your left. Try this. It's a wonderful practice. Same way. Other side, my left hand, and I'm putting my head to the left side, and the left hand is pushing it back to the right. Trying to push it down against the resistance. You can do it from the front, put your hands together. Same way, you try to put your head down and push your hand to the back. The same way in the back. To put it in the back, and the hand is going to push it in the front. And these are the things you need to do. That's what we say a yoga practice is 99% practice, 1% theory. There's not much theory in yoga practice. It's all in the practice. You can sit in a chair, do all this. I'm comfortable sitting in the ground. In fact, for my balancing, now I change my Sukhasana, easy pose. It's time to activate both sides of the brain. When I activate both sides of the brain, we become more. Excuse me. Say we do the your Jalniti every single day as a daily routine, and during practice you do get some drainage, you get some sneezing, which is entirely normal, and sometimes even you have some water comes out because it stays in your mucosa. So don't get surprised. I mean, you go to the public pool and you dip it down your whole head in a public pool, and you have no idea what is there in the public pool. Nose is very resistant. We live in the cities, most of the polluted cities, but we are fine, you know. Nose protects us. It's like your personal filter, personal air conditioner. Paschim Namaskar. Prayer pose to the back, spine straight, hands into the back, and slowly you put your hands together, or maybe I show it to you directly. So you have seen this, me doing it for many times, because this is one of the most important asana for keeping the posture. eyes closed, breathing out longer than breathing in. Check something here. I'm sorry, something was going on with the picture, but they're all back. Okay. So you remember, you don't do it, it's hurting me. So you do as a pain-free, effortless breathing. We're teaching you the concept of yoga therapy, that in stages, impossible become possible. So slowly you are creating a relaxation response because you have been sitting in this posture for a long period of time. At the beginning of your practice, you try to do it between 5 to 10 breaths, and once you are comfortable, when it comes to the point of sthiram, sukham, asanam, you can continue for a long, long period of time. Mind is the software, body is the hardware. When the mind quiets down, your pain also goes away. Mind quiets down with a practice called a Bhramri pranayam. Bhramri is a bumblebee. Our brain, our whole body has a frequency, and you create another frequency. Two frequencies interact and they cancel each other. It's called your harmonic resonance. When they cancel each other, your mind quiets down. So the practice will be, we will be doing the 4 postures of the neck, which is called a Brahma Mudra, because the pain or tightness in the neck also shows up in the upper back. It's one of the cause for the upper back pain. So the technique will be, breathing out first. Take a deep breath in. During breathing out, we'll do the sound of a bumblebee or bhramri. This also increases your exhalation. Exhalation becomes longer. Exhalation is parasympathetic and inhalation is sympathetic. Breathe out first. Take a deep breath in and slowly drop your neck to the back. And with the sound of a bumblebee, slowly bring your neck in the front. Notice I dropped my head down, brought my head back with the same exhalation. It extends your exhalation. And you put your head down, be sure there is no pain, and there's an effortless breathing. Effortless breathing is same as you're able to talk, able to sing, what I'm doing. Able to stay here between 5 to 10 breaths. Hold. Chronic upper back pain will completely disappear. It will melt away. Gomukhasana. A lot of people say, I cannot put my hands together, Try to do it in stages. Might use a small towel or a handkerchief, or maybe use what are those helping for yoga things you have? You can use one of those straps. Balancing. Now my left knee is in the top of my right knee. Left hand goes high up. Right hand comes in the middle. So let's put the right hand in the middle. Left hand down, you touch it, you hook it, and you stay where you are. Many a time you'll see your two sides, you have a little bit of difference. And when you get equal on both sides, you become a balance on both sides. Gomukhasana, cow face. Cat pose. Marjarasana. Wonderful asana for in a Marjarasana, get you to the tabletop, and the one way to measure your tabletop, your hand separation between the two knees and the same separation in between the knees and the hands. Drop your lumbar area down. Breathe out first. Take a deep breath in. Breathe out, get into the Marjarasana. Stretch like a cat in the back. In In yoga therapy, you stay in the pose to get the therapeutic benefit. When you learn, you go back and forth, and you stay between 5 to 10 breaths. Ustrasana, camel pose. He's coming off. To go a little bit to the back. Anyway, so touch both the ankle, body goes into the front, then your head drops down into the back. Ustrasana. Very good for your upper back. Vajrasana keeps your spine straight, keeps your head straight, and sit in a Vajrasana for a short time. You'll feel this is literally melting away. From here, so wonderful practices of Balasana, child's pose, hands all the way in the front. Always thinking about relaxing the upper part of the body. Even able to sit down in this Malasana, squatting pose, is very good for relaxation. Dandasana. Keeping your spine straight, body is at 90-degree angle, able to stay in the posture. Relaxation of the toes, breathe in, separate your toes, breathe out. Paschim Uttan Asana, seated forward bend, and you can also do standing up. It's called Uttan Asana. Hold on to your toes if you can. Close your eyes and slowly drop your body down. Keep coming down. Try to keep your knees as straight as possible. Try not to bend your knees. Jump all the way down. You can even clasp your hand. You can see me very well, so head will come all the way down. Touch your knees. Little spinal twist. Vakrasana. Left foot close to the right thigh. Right arm goes outside the left knee. Left hand goes to the back. And it comes down, touches your right knee. Continue your breathing in and out. Out longer than in. Turn your body all the way to the left. Eyes closed. Relaxation of the spine will also relieve your back pain, because the tightness of the spinal muscles, so called paraspinal muscles. Tightness of the paraspinal muscles also causes the pain. Opposite now, right foot next to your left thigh. Left arm goes outside the right knee. Right hand goes to the back. Left hand comes and touches the left knee. Deep breath in. Turn your body towards the right side. Stay in the posture for breathing out longer than breathing in. Savasana. It is a wonderful practice for your upper back, and lot of asanas on the face down, like your cobra pose, Bhujangasana, locust, Shalabhasana, bow pose, Dhanurasana. So wonderful practices for chronic upper back pain and lower back pain. In a Savasana, when you are comfortably relaxed, and you will get rid of the pain. Before that also, another wonderful asana is your getting rid of your upper back pain, is a fish pose, Vatsasana. When you lie down, also, be sure your chin is little lower. Chin is not sticking all the way. If chin is sticking all the way high up, then put a little pillow. And pillow under a folded blanket. So you'll be able to take it off the layer slowly when neuroplasticity sets in. Feet separated, the width of the mat. Put your hands down, you will see your little finger and thumb also will touch the ground. In a fish pose, put your hands on the side, get your body high up, drop your head down and raise your chest up and stay in the pose. If you have an issue on the back, what you can do, this is a small pillow, but you can get a bigger pillow. You can do a fish pose on a pillow. Matsasana on a pillow. Do a matsasana on a pillow and then drop your head down. Thicker the pillow will be, more chest will be more high up. Another nice technique is your yogic sit-ups, which also helps your core muscles, upper back, lower back, all the muscles, and brings the balance back, getting rid of your pain. So lay down, and get up and touch your toes. Sit-ups without any support. One of the most difficult sit-ups is called yogic sit-ups. Put your hand behind your head and then try to get up. Practicing with me. Start. Oh my God. See how I could do it very well, but again, all the way down. And we'll get high up. Hand behind your head and getting sit-ups. As I said, in a savasana, feet separated, width of your mat, hands down, 6 inches from your side, both little finger and thumb touching the ground. Whole hand, back of your head touching the ground. And he's also noticed that I always do wearing a health tracker. With a health tracker, you can see our physiological changes of the practices we have. Back pain literally melts away. In the meditation, the primary meditation for your chronic pain is your Bastrika, bellows. As you know, we explain all the time, it's like a pain reliever because it removes all the lactic acid, pyruvic acid, pain-producing substances. Alternate nostril breathing, Anulom Vilom Pranayama, which is also a wonderful practice. Brahmari pranayama, bumblebee. We have shown you all these, or we'll show you more in a pranayama practice, which we'll show you soon, and your Om pranayama, chanting pranayama. The therapeutic meditation is a chakra awakening meditation or chakra balancing meditation. Seven chakras, three lower chakras, root chakra, Muladhara chakra, pelvic chakra, Svadhisthana chakra, solar plexus chakra, Manipur chakra. These three are lower primate chakras, and these chakra balances done for a karma yoga. And balancing and awakening these chakras are needed for the relief of the chronic low back pain. Heart chakra, Anahata chakra, is a transition. We are developing our loving practice and become our spiritual practice. Upper three chakras, Vishuddha chakra, the throat chakra, Aga chakra, third eye chakra, Sahasrara chakra, or your crown chakra. Balancing and awakening this chakra causes your bhakti yoga. Bhakti yoga is spirituality, surrendering to your Supreme Being. Surrendering to a power above you. These balancing upper three chakras are needed to get rid of your upper back pain. So lower back pain is karma yoga for the lower three chakras, and upper back pain is a bhakti yoga for balancing the upper three chakras. Bhastrika pranayama is the most important pranayama for any kind of chronic pain, and you continue. Remember, I always hear this. We do it very slow. We do it very fast. No, you don't slow. There is no fast. There is no fast in any rule in therapeutic pranayama. Rule in therapeutic pranayama is that you are practicing pranayama as if it is your normal breath. There is no effort in breathing, totally effortless. You will be able to talk, you will be able to sing during a pranayama practice. It has no correlation how slow you do, how fast you do. I saw at 90 years a young, healthy-looking yoga practitioner. He is doing both Bhastrika and Kapalbhati pranayama, the breath of fire, as fast as you can do. But he's doing for a long period, for a long time, probably his whole life he's doing, is totally effortless. His talking, his breathing, completely effortless. So let's finish our practice with a practice of Bhastrika pranayama with your hand raised, and continue as long as you can. Another technique of Bhastrika pranayama also is that doing the Bhastrika Pranayama at the level where it hurts. Suppose I have a pain on the back, especially on turning my body. So what we are going to do is turn our body, come to a posture little short of pain, but there will be a discomfort. In that posture, we will be doing Bhastrika or bellows like this. And very simple, 200 of them. Generally, in our practice, we do 500 to 1,000 of this. And again, you see, I'm talking, I'm breathing, I'm totally effortless. Do a Bhastrika Pranayama with the hand raised. And see how many counts you can do. Completely effortlessly. You know, people can raise your hand like this and pull it down and get an effort. It's okay. Keep practicing. Breathe in, breathe out. Breathe in and pull it down with a Balo Mushti Mudra or baby fist. Preparing your body and mind. Sthiram Sukham Asanam. I'm in a Padmasana, lotus pose. And let's see how much we can do. I'll probably do a little bit. Continue a lot more. Spine straight, eyes closed. And a moderate speed, not too low, not too fast. did 125 in a moderate speed, 25 in a very slow speed, and the 50 in a very high speed. 200 counts, takes over a little bit of 3 minutes, and money back guarantee. The pain will be scared of you. Pain will say, this is not the body. I need to stay. Let me say goodbye from this body. Thank you for your time. Thank you for joining. We're talking about musculoskeletal system. So we'll continue. So next week, I'll be here. I'm in town, and what should we talk? And as you know, I'm not scripted. I'm never scripted. And we present this thing because we've been practicing it daily. Either shoulder pain or a neck pain, most common ones, and able to get up without a support. Thank you for joining this session. If you have any comments, any questions, please put it in the Facebook. And again, I'm not checking the Facebook that often, but when next time I'll check, I'll definitely will answer your questions and your comments. Okay, thank you. See you again next Saturday.